High blood pressure is one of the most common health conditions in the world. Millions of people live with it every day, often without knowing they have it. It doesn't usually cause pain. It doesn't always cause symptoms. And that's what makes it dangerous. In this episode, we'll take a closer look at what those blood pressure numbers mean and why they are important. When you have your blood pressure checked, you're often given two numbers. Many people nod politely and walk away after receiving the numbers. Others are told, oh, your numbers are slightly high. Others are reassured and life goes on. But those numbers aren't just measurements, they are messages. In this episode, I'm going to be talking about what those numbers mean and how understanding them can help you take control early. Hello and welcome to today's episode. My name is Dr. Ebua, so let's jump right in. Now, like I said before, blood pressure is often represented as two numbers. You have a top number and you have a bottom number. The top number is called the systolic pressure, and this measures the force of blood when your heart pumps. The bottom number is called the diastolic, and this measures the force of blood when your heart relaxes in between beats. Now, together, those two numbers give us a picture of how hard your heart and blood vessels are working in order to, circulate blood around your body. In cases where the numbers are high, even very slightly, it can put a strain on your body. Like I mentioned in the last episode, the blood vessels become narrow, they become less flexible, and inevitably, vital organs like your heart, your brain, and your kidney start to get affected because they're receiving a reduced amount of blood and less healthy blood flow. So again, who should be having their blood pressure numbers checked? Well, adults of all ages should have their blood pressure checked. If you feel perfectly fine, you should have your blood pressure checked because hypertension does not always cause a headache. It does not always cause dizziness or chest pain. Often this damage occurs very silently and could take a long time. And this is the reason why people might have a stroke or a heart attack even when they felt perfectly fine the day before. The process is often slow, often silent, and usually goes unnoticed. But these numbers can warn us even long before symptoms occur. Now, this video is not to replace any form of management or treatment from your healthcare provider. This is just education. And again, this series is mainly preventive medicine. So if you have been diagnosed with high blood pressure, please follow your doctor's advice on proper management of that. Now, back to what these numbers mean. It is important that you ask your healthcare provider exactly what these numbers mean for you, because in medicine, we don't jump straight into medication for high blood pressure. It all depends on your age, other morbidities or other illnesses you might be experiencing, sometimes your gender and your race. So a lot of factors go into prescribing medication. In the next episode, I'm going to be talking about how high blood pressure quietly damages your body. If you found the video useful, if you found it helpful, please do not forget to like, subscribe, share, leave a comment, and let's get the word out about our health. I'll see you in the next episode. Until then, take care.